I'm Dr. Ron Goren. I'm an infectious disease specialist for many, many years. Been through a lot of things. The latest, of course, being the COVID pandemic, which has been interesting and tragic to say the least. And my job here today is to discuss who should get the vaccine. And the short answer is everybody should get the vaccine. If you're over 16 for the Pfizer or over 18 for the Moderna, you should get the vaccine. These two vaccines are RNA vaccines. Moderna has, they both have 2 doses. Moderna is given 4 weeks apart, and the Pfizer is 3 weeks apart. But if something comes up and you can't get it in that period, you can delay it for up to 2 weeks and maybe even longer, but you want to get it as soon as you possibly can. The first dose gets your immune system going so it can fight the virus, and the second dose gives it a big boost. And we know from several studies that this vaccine works even after the first dose, but not completely, and works almost 94 to 95% after the second dose. You can get the vaccine even if you've had COVID, as long as you finish your 10-day isolation period and you're feeling well. There is no risk involved in that. In fact, it's probably a good idea to increase your immunity. You can wait 3 months just because you probably will have immunity for that period of time at least. If you've had the monoclonal antibody, and I won't explain it because if you've had it, you know who you are, you can wait 3 months because the antibody is doing its job and it will be there for at least 3 months. Common side effects of the vaccine are low-grade fever, headache, muscle aches and pains, and general tiredness, 2 of which I experience. But the good news is it really rarely lasts more than 36 to 48 hours. This vaccine we know is perfectly safe. You've heard about allergic reactions to the vaccine, and where we look at the numbers, it's only 4.5 people for every million patients who got it. That's a very small amount and very in line with other vaccines that we have. You can get this vaccine if you've had cancer or on chemotherapy. The vaccine is not dangerous to you. The question would be how much of a response you'll get. You can get the vaccine if you're on medications to suppress your immune system, such as people on steroids or patients who are on some of the biologics for rheumatoid arthritis and psoriasis. Again, not dangerous to you, but we still don't have all the answers as to how well you'll respond. You can get the disease if you have an autoimmune condition. I won't explain that, but if you have one, you'll know, and there is no evidence that these vaccines will cause you a problem. You can get the vaccine if you're pregnant. Animal studies show that this will not affect children, having children, and or affect your pregnancy. And the few pregnant women who've gotten it have not had any issues, and there is no scientific reason why this vaccine should affect you in any way. Contraindications, the only reasons you should not get this is if you've had a real anaphylactic or rapid allergic reaction to the vaccine, or you're allergic to one of the components, such as polyethylene glycol, which is a big word, but it's a very common component of things that we use for constipation. So some people may be allergic. People who have extensive allergic histories and take medications or shots for these allergies might want to check with their physicians, but in general, it's okay to get this vaccine. We normally watch people for 15 minutes after the shot. Patients with a high allergy history, we watch for 30 minutes. All these things are easily treated, and nobody has become seriously ill from these reactions to the vaccine. How do you get the vaccine? Well, that's really the issue. Supplies are constrained. We are dependent on the government and the state to give us the vaccine. We are currently trying to do the 1A category, which includes healthcare workers, patients over 65 who are more prone to getting very ill with this virus, patients between 16 and 64 who have underlying diseases such as diabetes or high blood pressure or heart trouble, who may also be more at risk for getting very, very sick, and residents of long-term care facilities who we are giving it to. And as we catch up with them and we get increased supply, we'll be able to give it to more people. The bottom line is this vaccine is safe. It is available to everybody except people who have been allergic to it or its components. And if that's the case, you could probably wind up with one of the other vaccines. This vaccine is the way to get us out of this crisis. We need to get as many people vaccinated as we can to slow the spread of this virus, slow the mutation rate of this virus, and maybe control some of these variants you hear about. This vaccine looks to be pretty good against the common variant in this country, the English variant, as we say. But there are others that we're currently working on, but in any case, they're not as prevalent here, and we need to get people vaccinated. So don't fear the vaccine. Get the vaccine as soon as you can, and as soon as it's available for you, it'll be fine.